Ever pondered why proper patient transfer techniques are crucial in healthcare settings? It's not just about moving a patient from point A to B. It's a delicate dance, a balance of safety, comfort, and dignity. Let's consider the risks first. Incorrect patient handling can lead to injuries. Think about the strain on the back, the potential for slips, falls, and other accidents. It's a threat to both the patient and the healthcare provider. Now imagine the discomfort and indignity a patient might feel when handled improperly. It's not pleasant, is it? Proper patient transfer techniques ensure that patients are moved with the utmost care and respect, preserving their comfort and dignity. In essence, these techniques are a cornerstone in healthcare settings, promoting safety and enhancing patient experience. They are not just techniques, but a manifestation of the care and respect we owe to our patients. Now that we understand why it's essential, we move on to breaking down the process of manual patient transfer into easy-to-follow steps. Dive into the process of manual patient transfer, step by step. This vital process is a three-stage journey. We start with the preparatory stage, transition into the actual transfer, and finally move into the post-transfer stage. Let's begin with the preparatory stage. This is the time to assess the patient's mobility level. Understanding the patient's abilities and limitations allows us to tailor the transfer process to their needs. Ask the patient about their comfort level with standing, pivoting, and walking. If the patient has limited mobility, consider the use of assistive devices like a transfer belt or slide board. This stage is also about preparing the receiving area, ensuring it's ready to welcome the patient. Make sure it's clean, safe, and free of obstacles that could pose a risk during the transfer. Once you've assessed the patient and prepared the receiving area, we move into the actual transfer. This is where your understanding of proper body mechanics comes into play. It's important to maintain good posture throughout the transfer to protect both yourself and the patient. Bend from your knees, not your back. Keep your feet shoulder width apart for stability, and always face the direction you're moving. Coordination with the patient is crucial during this stage. Communicate clearly, explaining each step of the process. Ask the patient to assist as much as they can, encouraging them to use their strength to stand, pivot, or move. Now the patient is in their new location. This brings us to the post-transfer stage. Your job isn't over yet. Check in with the patient, asking about their comfort and any potential pain. Adjust their position as needed to ensure they're comfortable and secure. It's also essential to check the patient's skin for any signs of pressure or friction from the transfer. Lastly, don't forget about the equipment used during the transfer. Clean and store any assistive devices properly for future use. This is also the time to wash your hands and document the transfer in the patient's records, noting any changes in their condition or ability to assist with the transfer. Remember, every patient is unique, and so is every transfer. It's essential to adapt these steps to each patient's individual needs and abilities. Be patient, be gentle, and always prioritize the patient's safety and comfort. With these steps clearly outlined, manual patient transfer should be a breeze. But remember, practice makes perfect. Now let's quickly recap the key points we've discussed. First and foremost, we underscored the significance of appropriate patient transfer techniques. These are not just procedural steps, they are vital tools in ensuring the safety, comfort, and dignity of patients. A well-executed patient transfer can make a world of difference in a patient's overall healthcare experience. We then walked through the process of manual patient transfer. Step by step, we unveiled a procedure that, when executed correctly, can help prevent injuries, maintain patient dignity, and promote a positive healthcare environment. We also highlighted the potential risks associated with improper handling. Remember, improper techniques can lead to unfortunate incidents, causing harm to both the patient and the healthcare provider. Finally, we emphasized the value of these techniques in maintaining patient comfort and promoting dignity. It's about more than just moving a patient. It's about respecting their individual needs and experiences. Mastering proper patient transfer techniques is an essential skill in healthcare. With practice and patience, it can be second nature. Remember, safety first for both the patient and yourself.